Hello, everyone, and welcome to our webinar today on School and Child Care Roster Lookup, or SQUIRREL is what we call it. Today we'll be covering on what it is and how to use it. Today is Wednesday, April 26, 2023. We will be convening today from 12 p.m. to 1 p.m. Pacific time. And on behalf of our team at the California Department of Public Health, CDPH, I want to thank you for joining us during your lunch hour to learn about this new exciting tool, SQUIRREL. Next. And just as a quick introduction, I'm Ahana Singh, a school located vaccination coordinator at CDPH. We'll be spending this hour we have together learning about the school and child care roster lookup, SQUIRREL, which is this new exciting tool that is ever evolving and is hopefully making it easier for us to understand whether children and students meet immunization requirements for school and child care entry. And just to quickly go over our housekeeping here, this webinar is conducted in collaboration with California Immunization Coalition, CIC. We are holding 3 different webinars for 3 essential target audiences. The first one was local health jurisdictions, LHJs, inclusive of county and city health departments, and that was on Monday, this past Monday, the 24th. Today is for school, K-12 schools. And then on Friday, we'll have our childcare and pre-K sites on the 28th. And so just please note that, registration is tailored to each audience. So folks may be attending today who are not from the K-12 site, but that is okay. If this is the case, however, and you would like more information or detail on a topic, we advise that you check out the recording for the respective audience once it's posted online. And so we advise that. And then also follow-up correspondence will be sent out with this information as well. So please be on the lookout. And then lastly, I also want to make sure you all know that please be aware that content and demos are slightly modified for the different audiences. So something to look out for as well. Next. And just to quickly go over our agenda here today, we will be going over an overview of California Immunization Coalition, CIC, and then we'll go over and learn a little bit more about the California systems and policies related to school vaccination. And then we'll go over the demonstration of SQUIRREL, something I know that we are all waiting for. And then we'll cover some FAQs, some Q&As that you had entered at registration. So we'll definitely review that. And then we'll wrap it up with some information on office hours in May, and then evaluation and wrap up. And so without further ado, I would like to kindly introduce Catherine Flores, Executive Director at California Immunization Coalition. Take it away.
Thank you so much, Ahana, and thank you to the whole team at the California Department of Public Health Immunization Branch for putting together this great training. As Ahana said, part of 3 that we're having this week. So next slide. So the California Immunization Coalition is a statewide nonprofit, a 501c3 organization, and we're dedicated to maintaining full immunization protection for all Californians to promote health and prevent serious illness. And you can find us here at immunizeca.org. And we've been working together as a coalition for almost 25 years, and throughout, we have supported and worked with the California Department of Public Health to make sure we are partnering, making sure that we are promoting and making these great things happen that we have. So check us out on the immunizeca.org website. So I'm going to tell you a little bit about what we do, how we've worked with CDPH and schools in particular. We're very excited to have these all of you folks on the call today. So mainly what we do with the coalition is around advocacy and education. Obviously, advocacy in terms of making sure we have good policies, good bills at the legislature, making sure we're squashing any bad bills or things that are not going to help move our progress for, help progress immunization rates. And I think on balance, we've done amazing things. California has among the highest rates in California and the strongest laws around school vaccination requirements. So I think thanks to all of you, thanks to the all of our network partners, we've done great things in California. So that's something to be proud of and celebrate in between all the other things that are happening in politics and in policy making. So again, working to make sure we have strong policies and nothing negative, and then a lot of work on education, making sure that our partners know about where to go for the latest information around vaccines, around communication strategies, around what's next. And we try to make sure you have access to information from the CDPH, obviously, the CDC, Vaccinate Your Family, the National Foundation for Infectious Diseases, Immunization Action Coalition. There are so many groups, so many new partners that we're working with throughout the country now to make sure you have access to the latest information. It is kind of a challenge to make sure we get all that information out. And of course, we partner with the school nurses organizations, the school districts, schools, to make sure we are staying in touch, staying on top of what you need to know about in terms of vaccinations. It's been really strong partners and in working with schools and school nurses in particular. Next. So as I've said earlier, next slide, thanks. Said earlier, 4 of the ways that we implement our vision is to encourage community-based advocacy, working with, again, our network partners like the American Academy of Pediatrics, the Family Physicians, Medical Society, all kinds of groups to make sure that we are all on the same page with about our goals, which are, of course, to improve our vaccination rates for Californians of all ages. But, it's beyond California, too. We want to make sure, obviously, diseases cross state lines. We get diseases from other countries that enter the United States, obviously. So we talk about California, of course, but we all know that it's important to keep up with everybody and what's going on throughout the country and in the world, because inevitably it joins us here. So just want to talk about California. Of course, that's our focus, but we know that this impacts everyone. So we encourage community-based advocacy. We support local immunization coalitions. I won't talk about that too much right now, but we have quite a few wonderful local immunization coalitions from the northern regions to the southern regions and Central Valley, Central Coast, Bay Area, that are working hard to make sure that the local needs are addressed. And what CIC provides is technical support. We meet together as directors every quarter to make sure that we are keeping up with each other and supporting each other. And finally, excuse me, as I said earlier, we provide educational opportunities for healthcare providers, for health services providers like yourselves, to make sure you have the up-to-date information on vaccines, what's being recommended at ACIP, what's new, what's coming up. But most importantly, a lot of what we've been doing the last couple of years is around communication strategies, as you know, how we can speak with parents most effectively, how we can demonstrate to the community that we are the folks that you want to listen to on vaccine issues, vaccine questions, and come to us, come to CDPH, come to our health partners for that information. Thanks, Cameron. Next. And so, and throughout my time in public health and with the Immunization Coalition, we've been working with the California Immunization Registry in various ways. We have always been a champion for the registry because I personally have always known, once I saw how this worked, and it was way different 20 years ago, I knew that this was the key to making sure we could get our communities immunized, get them immunized, keep them up to date, and get this information shared throughout. It's really the only way. And I think our community here on this call recognizes that, and that's why you're here. That's why you're maybe using this in your work already. And why we're excited to hear about the new features that are going to be available to you, because I think it really is key. And our coalition has always been a partner in making sure the registry is supported. Next. If you are on social media, we love to stay in touch with you. We know social media is a mixed bag nowadays, but there is some good stuff. And mostly we stay in touch with folks in terms of with professionals, other professionals. We're not out there personally, we're not out there to be cheeky or to be obnoxious or cause trouble out there. We share information, but we also kind of get in there sometimes and make our statement about, especially always around vaccines, but sometimes around, public health issues as well. But for the most part, it's all really good, and it'll lead you to some other good people that you can follow as well. So give us a follow, mostly on Immunize CA is our handles. Next. So basically, before I hand it over to our next speaker, I want to thank you for all you do as school health professionals. You are our partners and colleagues. You do amazing work. I'm always in awe of how school health professionals get so much done. I know I don't need to tell you this, but I'll say it anyway. It's like people have no idea what school nurses, school health personnel do nowadays. They seriously don't. They still think that there's a school nurse in not everybody, many people still think there's a school nurse in every school, that there's, and then that they're just giving shots and band-aids. But we know that you do a lot of work, and what we're sharing today is part of it, and it's part of a very important piece. CIC, when it comes to legislation and education and some of these endeavors, we take the long view. The registry has taken a long time to get to this point, but things are happening fast and really happening and really great, exciting things. And so I'm really excited to hear about the next steps for SCRL, SQUIRREL, and look forward to hearing your questions. Some questions have already been submitted, and I know we're going to talk about that after. I want to thank you for all you do. Next slide. There's our contact information, info@immunizeca.org, if you'd like to get a hold of us directly. And like I said, check out our website. We try to keep up with everything. We've got a big summit coming up next week, so we're kind of challenged on our website a little bit, but we really appreciate all of your input, ideas, and staying in touch. And with that, I'll hand it off to my colleague, Amy Pine.
Oh my gosh, so many things. I wish I could second what you just said, Catherine. Appreciation for everyone out there. And to please sign up for the summit if you're interested in attending. Just check out the California Immunization Coalition website, because it's probably not too late to register. I don't know, maybe it is too late. Is it? It's not too late to register, is it, Catherine? Not sure. Okay, anyway, I'm Amy Pine. I am, is it still okay to register for the conference, Catherine?
Oh, I'm sorry, I thought I told you. You know what, send us an email at info@immunizeca.org.
Okay,
I don't know what the registration's looking right now, but we are pretty full. But thank you for
conference next week. Very exciting. Okay. Anyway, I am Amy Pine. I am the school vaccination team co-lead here at the California Department of Public Health. Really happy to be able to speak with you all today about this alphabet soup of CARE, SCRL, and California immunization laws. I'm going to go through some things rather quickly, just because I know that you're all here mostly to see the demonstration. But so CARE, CARE Hub, SCRL, so many acronyms. What do all of these things mean? And basically, CARE is the California, and I'm also going to take myself off camera because I think I'm more nervous when I'm on camera, but this way you'll be able to focus more on the content anyway. Okay, so anyway, the CARE is the California Immunization Registry. It is a secure, confidential, statewide computerized immunization information system for California residents. And there's now a California law that says all administered doses of immunizations must be entered into CARE. Assembly Bill 1797 went into effect January 1st of this year. And it's been really, really exciting to know that all immunizations will end up in the California Immunization Registry. There is another immunization information system in the Central Valley. It's called RIDE. And so the AB 1797 says that all administered doses in that catchment area must be entered into the RIDE system. And the good news is that the RIDE system communicates in almost real time with CARE. So basically all doses end up in CARE, the California Immunization Registry. So the next acronym here is CARE Hub. And CARE Hub is an umbrella platform, or it could also be called a portal, where schools and childcare sites access applications that are related to CARE. Currently, the only application that is a part of CARE Hub is the school and childcare roster lookup. But Care Hub is in constant, there are plans for Care Hub to be, to have future enhancements that will include accessing the CARE medical exemption system, as well as the annual school immunization reporting portal. So all of you schools out there that have to do annual immunization reporting, this fall, it will be through a brand new portal, but I think you'll also be super excited because it's really cool and it's going to look really great and hopefully be super intuitive. Okay, last acronym here is SQUIRREL, SCRL, the School and Childcare Roster Lookup Tool. It is an application designed specifically for you all, school and childcare staff, to determine whether or not students meet immunization requirements for school or childcare entry. And SQUIRREL communicates directly with CARE. But you cannot access SQUIRREL without registering in Care Hub. Okay, so we're going to learn more about that as this webinar continues. Next, please. Okay, now just breaking these acronyms down. CARE, the California Immunization Registry, is accessible by providers, local health departments, the Women, Infants, and Children program. And then prior to this year, there was also a user ID for CARE that was called read-only access for schools. This was prior to the invention of the School and Childcare Roster Lookup tool. CARE does show all administered doses that have been entered by a provider, and the data will be more robust depending on how long that provider has participated in CARE. Now, there's the law that says all providers have to participate in CARE, but a lot of providers are pretty new to CARE. Maybe they just started with the pandemic so they could enter COVID-19 vaccines. A lot of providers still don't participate in CARE, so we are slowly making our way through the list to make sure that all providers do participate in CARE, but how robust the data is for your patient or your student might depend on how long their provider has participated in CARE. CARE can print out yellow cards, it can print out blue cards, or it can print out comprehensive histories and routing slips for patients. CARE does feed or power the digital vaccine record. I have one more slide about that. But CARE does not easily have a component that easily says ready or not ready for school entry. So that is also why we felt it was important to create SQUIRREL. Next, please. The digital vaccine record, since I mentioned that in the previous slide, I wanted to make sure that you all knew about it because this is something pretty special for California. It started as a digital COVID vaccine record, allowing people to easily see their COVID-19 vaccine information, and it expanded to include all vaccines. So now a person in California can actually request their digital vaccine record, which is an electronic vaccine record from California Immunization Registry. It is an official record of the state of California, just like the yellow card. It includes a person's name, their date of birth, their vaccination dates, and the vaccines that they received. It also includes future recommended vaccines and timelines. It takes information directly from CARE. It's a great tool for all Californians. There's a link to frequently asked questions on this slide. There's a link also to the digital vaccine record itself. I encourage you to encourage your families, your students, your student families to try finding records from the digital vaccine record portal, because it really is going to also make it a lot easier for provider offices, for parents no longer having to call them and ask for comprehensive vaccine records. They can just do it electronically on their own. Very exciting news. Okay, next alphabet soup that we talked about was Care Hub, the umbrella platform that houses applications. Currently, it houses SQUIRREL. We call it SQUIRREL just because it's easier to abbreviate the acronym SCRL that way, and also because we got to produce this cute little squirrel mascot. So on this slide, this is a slide of the homepage of Care Hub in its current state. And the green arrows on this slide are pointing to all of the points of Care Hub on the Care Hub homepage right now that are directly related to the School and Childcare Roster Lookup tool. So the arrows at the top have to do with registering for the first time and then signing in. The middle arrow has to do with signing in. And then the bottom arrow has to do, point you directly to instructions on how to enroll and register, and also how to use SQUIRREL, some frequently asked questions. So this is the, just reiterating, this is the homepage of Care Hub, which houses SQUIRREL. You must register in Care Hub first to be able to use SQUIRREL. Next slide, please. Okay, the School and Childcare Roster Lookup tool, SQUIRREL. It's a tool that makes immunization record checking of children easy for schools and childcare facilities. It uses the pre-kindergarten and TK transitional kindergarten through 12th grade immunization requirements, and communicates with CARE directly on to determine which students are complete, which are conditional entrants, and which are overdue. And those are the three categories that SQUIRREL does use to classify students. SQUIRREL also only accesses immunization information that is related to school or childcare requirements. So if something like COVID-19 vaccine is not a school immunization requirement, that information will not be available in SQUIRREL. SQUIRREL is only accessing the immunizations related to school or childcare law. Why SQUIRREL? Well, I mean, first and foremost, it takes the guesswork out of who is eligible for entry and who is not. You as a school personnel do not have to make any calculations to determine which student might be complete, which student might be a conditional entrant, or when a next dose might be due. SQUIRREL does all of that work for you. SQUIRREL is also targeted to the immunizations required for school enrollment, and it helps you accomplish that implementation for the annual requirements of school and childcare to make sure that those students that enroll are up to date with their immunizations. Okay, now speaking of California immunization law, next please. California, I think you all know this on this call, but just to reiterate, California does have a law that says schools are required to check immunization records for all new student admissions for pre-K sites and TK through 12th grade sites, and all students advancing to 7th grade before entry. This applies to all students, private and public schools, regardless of their grade and regardless of when during the year they are starting school. I'm not going to, okay, and with the next slide, yes, please, thank you. In terms of how we break down the requirements, there is 3 ways of looking at this. Basically, California law says that you should unconditionally admit a pupil whose parent or guardian has provided documentation of receipt of immunization or has a permanent medical exemption. Those students would be considered complete. The second category is to conditionally admit any pupil who lacks documentation for unconditional admission if the pupil has commenced receiving doses of all the vaccines required for the pupil's grade and is not currently due for any doses at the time of admission, or has a temporary medical exemption from from some or all required immunizations. So I like to use the example of MMR for conditional entrance. MMR requirement is 2 doses separated by at least 4 weeks. If a student just received their first dose of MMR a week before starting school, they should start school. They are conditional admit. They are not due for their second MMR for at least another 3 weeks. So there's no reason to keep them out of school because they're not due for any vaccines. The students who should not be admitted to students would be this third category, the overdue students. If that student that I was just talking about that received an MMR, if they received their first MMR a year ago, their second MMR could have been given a month after their first, and they are overdue for that second MMR. They should not be admitted to school. Now, a lot of the questions that were submitted before this webinar had to do with school interpretation of school law, and we don't have the time to go into all of them today because this is about SQUIRREL, but there are so many resources. Oh, darn it, I'm getting ahead of myself. Cameron, if you wouldn't mind, just, yes, please. So the medical exemptions, because medical exemptions were mentioned on the previous slide, I did want to make sure that I think also everyone knows this, but just in case, as of January 1st, 2021, all new medical exemptions in California must be through one centralized care medical exemption system. So if you are receiving a medical exemption for a student now, there's only one form, and it's a form that is published and created from the electronic care ME system. Paper medical exemptions from before January 1st of 2021 might still be in circulation until as late as 2028, but anything that is January 1st, 2021 or later has to be from the centralized care ME system. There's a link here about exemption information for schools. And just to say again that the care medical exemption system does not yet communicate with SQUIRREL, but that is an enhancement that is slated for the future. I was starting to say that there are so many resources available for all of you. You as school staff don't ever have to know the answers to all the questions, but you do need to know where to go to find the answers to the questions. And the Shots for School website is a place where you can go. It has so many resources for you, school staff. It also has resources for parents. It has resources for how to talk to parents as school staff. And I just want you to be aware of this website. I also want you to be aware on the next slide of the fact that we actually have training modules that are new, that were also just produced this past year, but really exciting. And if you have anyone that is needing a refresher course about interpreting school immunization law, or you have a new person, or maybe you have just recently told a staff member, oh, now this is part of your job, to check immunization records before enrolling, this is where you should start. We have several training modules for learning how to become an immunization expert at your school. So please, there are links to these training modules. We will also be including all of these links in the slides afterwards. And I would definitely recommend this and the Shots for School website be your go-to sites that are always bookmarked for all things related to school immunization law. Coming really quickly back to the life cycle of the school and childcare roster lookup tool and producing an immunization report to say whether or not a child is complete, a conditional entrant, or overdue. This is just a graphic of how it starts, because we want you to feel absolutely comfortable with this and not have any guesswork. So the whole process from start to finish is first that you register in Care Hub. Then you sign in to the SQUIRREL tool, where you can go to the roster management dashboard. I have a little arrow pointing to like what the roster management dashboard looks like. And the roster management dashboard becomes your friend. You have three options on the roster management dashboard, which is to upload a file from your own student information system, or you can create a roster, or you can look up a single student. So then you create a roster, you report, you upload it into the SQUIRREL tool. SQUIRREL then communicates with CARE, and you get the ability to view a list of student results in SQUIRREL. And then from that report, you as a school decide what to do for your subsequent actions. You can absolutely ignore the children who are complete, because no subsequent action has to be done with them. For the conditional entrants, it tells you when you'll need to follow up with them. And for the overdues, it's like, yeah, you should get some immunizations before you enter school. So I think I just have 2 more slides, but on this next one, I wanted to just say what, reiterating that SQUIRREL communicates with CARE. The information in SQUIRREL basically mimics the information that is in the California Immunization Registry. If it is not in the registry, it's not going to be in SQUIRREL. So if there was, for example, a birth dose of hepatitis B that never made it into the California Immunization Registry, then that won't be showing up in SQUIRREL either. If it is in care as a record that is not to be shared, then it is considered locked in the SQUIRREL system. So there are families in California who have said the only provider that I want to be able to access my immunization information is my primary care provider. I don't want any other doctors even to see it. That is a record that is considered to be not shared in care. So it will show up in your SQUIRREL report as locked. And in that case, you'd have to ask the family to please provide a paper copy of their immunization history. If there is data that you don't find in SQUIRREL, it's probably because the provider hasn't been using in care. Maybe maybe their provider's using it now, but maybe when they started using it, they didn't enter historical doses, or maybe they don't yet use care. But basically, if there's data that's not in care, it has to do probably with the provider and how long they've been using care. Excuse me. If there's data that's not in SQUIRREL, it has to do with how long the provider has been using care. If you have information that is not complete from both the SQUIRREL system and from the piece of paper that the family submits to you, then I think in those instances, your options are only to tell the family to get a more complete record from their primary care provider, or to go get their missing doses and go get immunized. And then I just have one more slide to reiterate that SQUIRREL is open for registration now. We would love for you to register if you haven't already, to be able to use SQUIRREL. Do it now before the end of the school year so that you're all set for enrollment and reporting this fall. I know that a lot of fall enrollment activities have already started happening. We will be also, now's a good time to register too, because we are offering more technical assistance. And we will be offering office hours in May to answer questions that you might have about SQUIRREL. Also, it is our intention for the school and childcare roster lookup tool to replace the read-only access that school users had for care. It is our intention to have that, to have SQUIRREL replace care entirely for schools, but we do not yet have a set timeline on when that will happen. We want to give at least preferably 4 weeks notice once we confirm that date, but a date has not yet been confirmed. And I also wanted to reiterate that nothing will be changing for any clinical sites. This includes school-based health centers. Any clinical sites using care will absolutely still have the ability to, no permissions or access will change for any clinical sites using care, especially at schools. That is it for me, but I am now very happy to turn things over to Alana Hintz with MCorp. And MCorp is the contracted company that CDPH has formed a relationship with to produce SQUIRREL. So Alana, thank you for being here, and please take it away.
Thank you, Amy. Hello, everyone. My name is Alana Hintz, and I am a senior project manager with MCorp. And today I will be doing a demonstration on SQUIRREL. Welcome, and thank you for joining us today. We are pleased to be demonstrating the school and childcare roster lookup module in the Care Hub portal. SQUIRREL is available to schools, school districts, and child care facilities to check the immunization status of a student by grade and vaccine schedule. Users can view each child's immunization status online or by downloading an editable report that details which children have not yet met the vaccine requirement and provides guidance on needed vaccines for entry into a selected grade level. The contents that I will be covering today in SQUIRREL are how to register, roster management, and how to use single student lookup. Next. How to register. Setting up an account takes less than 5 minutes with just your email address and a password you create. Next. How to register an invited user. Step number 1, receive an invitation. To be able to sign into the Care Hub, you must receive an invitation to register via email. If you are an org admin and have not received an invitation, you will be able to register, but when you attempt to sign in, you will be directed to the enrollment page. You will then enroll your organization by filling out the enrollment application. The application then goes through a verification and approval process. Once approved, you will then receive an invitation email and be able to sign in. If you are a school or child care facility employee and would like to use the Care Hub, please contact your organization administrator. Ask them to enroll in the Care Hub and register your organization, and then have them invite you to register. Step number 2, from the Care Hub welcome page, simply click on the register button located at the top of the page. Step number 3, agree to the user access agreement. On the website user access agreement page, read the Care user terms and conditions, and then click the I agree to the user access agreement button. Step number 4, request a verification code. Enter your email address and click the send verification code. A message appears stating verification code has been sent to your email inbox. Please note that it is important that you use the email address from your invitation to register as shown here. Step number 5, get your verification code. Go to your email account, copy the code from the email that the system sent, and then paste the code into the verification code field. And then click the verify code button. Step number 6, create a password. Enter your password to both the new password and the confirm new password fields. Then click the create button. This will then take you to the Welcome to Care Hub screen. Once you have entered these steps, log in and set up your user profile. You will then be able to access the school and child care roster lookup. I will now be sharing my screen to demonstrate the roster management feature. Users can upload a roster file from their student information system or build one from a template we provide to request the children's immunization data from Care2. Care2 will then return information on the children who have records in the registry, and SQUIRREL then calculates any required vaccines that are overdue or conditionally met, giving the user an indicator of whether the child is complete on the necessary vaccines to enroll in a school or child care facility. From the roster management page, you will have the options to upload a roster file, build a roster, or search for a single student. Users can click on the Upload a Roster File button to upload a CSV file of students' information. You can configure your student information system to export a file, or you can build a file using a template accessible via the Learn More link here. The CSV file needs to include the following required fields: the student's first and last name, date of birth, grade, and student ID to help locate the student in care. Users can also add other identifying data such as school ID, middle name, gender, and parents' first name to support school reporting. For incoming students without a student ID, users may enter any number. Once you have uploaded a file, it will start processing and checking the Care2 immunization registry for the students on your roster and their vaccine status related to school entry. Please note that larger files may take a while to process, but you can log off and come back later. The file will keep processing even if you are logged off. You will then get an email notification from your file when your file finishes processing. An uploaded file roster is kept for 1 year from the date added. When your file is fully processed, it will show a status of completed. You can also delete a file at any time by clicking on the red trash can. You will confirm if you want to delete the file by clicking yes. The file then will delete from your user files. If an exact match is found, you can also view your immunization status of each student on your roster by simply clicking on the file name. And if an exact match is found between the student information from your roster and Care 2, the lookup will show you the student status for each immunization required for school and child care entry. The immunization status types include complete, conditional, locked, and overdue. According to the tracking schedule you select, either TK, K through 12, or pre-K. We will now view a conditional student. To help keep track of students who have been admitted conditionally, this file also shows you the dates range of when the next doses will be due for the student to be able to stay in school and meet all immunization requirements. The roster lookup will also identify students who could not be found in the immunization registry. You can try to find the student again by updating or refining your identifying data and uploading a new roster. Some students may not have immunizations in the registry, either because their primary care provider does not yet communicate with the registry, or maybe they have just moved and haven't yet established their medical home. When this is the case, you will need to follow up with the student's parents or guardians for immunization information. We will now view a multi-match student. When the student information provided on a roster matches more than one record in the immunization registry, click the one that matches and click one of the matches to include it on the student for the report. In this case, I know that Nathan Wilder is the correct student to select here. I would simply click his name and click OK, and he will then show in my student roster. For easy follow-up, users can use the advanced filter feature to filter by vaccine type or filter for students whose records are locked, not found, or need to be reviewed because of multi-matches. You can also delete any student at any time that you do not need to follow up on. This might include students who are fully up to date and do not need any further attention. Simply check the box next to the student name and then delete the selected student. A pop-up box will come up to confirm that you want to delete the student and simply click yes. The student is then deleted from your records. When you are satisfied with how you have arranged your file in terms of filters and students, simply click the download button shown here to save the student report as an Excel file to your computer. SQUIRREL combines the CARE 2 Student Compliance Report and the Student Immunization History Report. The report offers additional information to assist schools and child care facilities in determining which immunization requirements have not yet been met. The report is easy to read and has color coding. With this report, you are also able to filter and sort on any field. The report also provides helpful and comprehensive comments on any overdue or conditionally met vaccines. To close the roster management report page, click on the arrow beside the file name. From the roster management page, you can also build a student roster. Here you can manually enter the required information for each child or student. Step number 1 would be to simply enter in the file name. Step number 2, enter the required information. Users can also add other identifying data. Here I will enter in a last name, first name, the date of birth, and the grade. The system accepts only the following values for grades: -5 through 13 and K. Grade values -5, 4, 3, 2, and 1 are pre-K values. For example, -1, 1 year to kindergarten, -2 to kindergarten, and so on. Once you have entered all your information, simply click Add to Roster. The student will then show up in the roster section. From here, you have the option to edit or delete a student. When you are satisfied with your entries, simply click Submit. SQUIRREL then requests information data from CARE 2. CARE 2 will then return the known student's information. SQUIRREL then calculates and provides the student details and the status of the vaccine requirements. After clicking the Submit button, you can locate your file under User Files. From the roster management page, you can also search for a single student. Enter the required information in the search fields. You would enter the last name, first name, grade, and date of birth. From the single student lookup, you also have the option to clear any search details by simply clicking on the Reset button. I'm going to re-enter this student so I can show you the next step. After you've entered the required information, click the search button. SQUIRREL then brings back the student information details. You can change the tracking schedule by clicking the down arrow to either show pre-K or K through 12. To open the student detail screen, click anywhere in the student row. Here you will see the student details and the status of vaccine requirements. To view the vaccine history and see the immunization record for the student, click on the Vaccine History tab. On the vaccine history page, you can change the tracking schedule to view the missing dose for that tracking schedule. Note here, it defaults to TK K through 12, and the missing doses that are seen are polio and DTaP. When I change the tracking schedule to pre-K, know that the missing doses are now polio and MMR. Here you will also be able to see the student's immunization record, the required vaccine name, the date administered, and the series if applicable. From the vaccine history page, you can also print the student's blue card. The blue card opens up to a PDF where you can then download it to your computer or print it. To close the vaccine history page, click on the arrow beside the student's name. The roster management page reopens and your single student lookup details are cleared. This is the end of my demonstration, and I would like to thank you all for participating today. When a new product such as SQUIRREL is rolled out, it is always great for us to hear feedback and learn what customers like, or if there are any suggestions. You and your colleagues are an important part of that process, and we want to thank you. We are confident that SQUIRREL will indeed meet your needs. Thank you again, and I will now be turning things over to Naveen.
Thanks, Alana. I am Naveen Makhtoom, Coordinator for School-Located Vaccination Team in the California Department of Public Health. Today, I will be reviewing some frequently asked questions, and thank you so much for sending your questions to us. If we don't get time to go over all the questions today, we will cover them in the upcoming office hours in May. So the first question is, are we required to use SQUIRREL? And the response to that is, school and childcare sites are not required to use SQUIRREL, but we hope that you will all want to use it, and the time to register for it is now. Once you have access and know how to use it, it serves as another tool to easily view your students' immunization status. Next question is, can SQUIRREL print yellow cards? And the answer to that is no. SQUIRREL can print blue cards, not yellow cards. SQUIRREL is a tool specifically for school and childcare sites and related immunization information. The California School Immunization Record, that is the blue card, is the only record that school or childcare sites may need to print. If a family is needing a yellow card, they should ask their doctor's office, or they can access it from California's digital vaccine record. Next question is, what are the required fields for SQUIRREL? For uploaded rosters, the required fields are student's first name, last name, date of birth, student ID, and grade. Please note that student ID is not required for the build a roster function or for single student lookup. Next question is, why is the grade a required field for roster management? And the answer to that is, the current grade requirement is related to pre-K, transitional kindergarten, kindergarten to 12, and Tdap vaccine requirements. Specifically to Tdap, it must be administered on or after the 7th birthday and must be given before 7th grade. If we have no grade, then we cannot determine if grade requirement has been met. The question is, what if I am using the single student lookup and I do not know what grade they will be entering? So the answer to that is, if you don't know the grade for an enrolling student and are wanting to use SQUIRREL, simply estimate based on their age. Next. How many people can be registered in SQUIRREL from school and childcare sites? And the answer is, there is no limit to how many SQUIRREL users there can be from individual schools or childcare sites. Is SQUIRREL connected to CareMe or the immunization reporting website? And answer is not yet, but there are plans in place for SQUIRREL to communicate directly with both websites or portals in the future. Next question is, what should I do if SQUIRREL shows students that are conditional or overdue? So the answer is not all doses may be entered into CARE. If you haven't already, ask parents for their children's immunization records as well. If children are still missing doses, let the parents know when the missing doses are due. And there is a link in the slide to letter to parents for immunizations needed. When should I use SQUIRREL? And the answer is SQUIRREL should be used anytime you are unsure of a student's immunization status for school entry. If you are using a student's information system that shows a student as complete, it is not necessary to again look for that student in SQUIRREL. Now, where to get more information? Here is a list of active links and resources, which include SQUIRREL fact sheet, instructions on registering in CareHub to access SQUIRREL, website to log in to SQUIRREL for already registered users, SQUIRREL user manual, FAQs, training video, SQUIRREL immunization laws webpage, and your local health department's immunization program. For any questions related to CareHub or SQUIRREL, you can email us at carehub@cdph.ca.gov or call help desk at 800-578-7889. Thank you, and now I'm turning things over to Ahana. Thank you.
Thank you so much, Naveen. Next. Alrighty, as for our next steps here, we're talking about office hours, which will be hosted next month, month of May, for 3 consecutive Fridays. So the first one will be on Friday, May 12th from 12 p.m. to 1 p.m. Pacific time. The second one will be on Friday, May 19th. And then the third one will be on Friday, May 26th, again from 12 p.m. to 1 p.m. Pacific time for all of them. Before we close today, I would like to give big thanks to all of our speakers. And again, on behalf of our team here at CDPH, thank you again for joining us.